Chicagoans are marking World AIDS Day today by remembering those who have been lost to the virus and those who've been saved by the breakthroughs in treatment over the past several decades.
Dr. Beverly Shaw from Rush University Medical Center has been partnering with one of the largest AIDS clinics in the country. She joins us now. Thank you so much for joining us. There's been a lot of work done, a lot of research towards AIDS, but there's a lot more yet to do. Why are we at this point still, after 40 years or so of AIDS being found?
Well, I think, yes, you're correct. We have had a lot of advances in the treatment and prevention of HIV. Nowadays, large numbers of patients can take one pill a day and have very few side effects and do well for decades. We've learned that people at risk for being exposed to HIV can take also a pill a day and markedly reduce their risk of acquiring HIV. Nevertheless, we still see new cases of HIV, and unfortunately, increasingly, the proportion of those new cases occurring in Black and Latinx populations is increasing.
And the theme for World AIDS Day this year is Know Your Status. So with that in mind, who would you say should get tested and how?
So CDC guidance says that anybody 13 to 64 years of age who has been sexually active should have at least one HIV test in their lifetime. We know there can be a very long asymptomatic period where someone who is infected with HIV has no symptoms and thus could unknowingly carry the virus and transmit it to others. So routine testing, irrespective of risk other than history of being sexually active, intravenous drug use, those things, we want to test beyond those groups and really test everyone.
I'd like to go back. You mentioned the disparities in the Black and brown communities. There are also disparities for COVID-19 in the Black and brown communities. How do we change that? We are talking about this since the beginning. How does that change? Is it education? Is it more resources? Is it more money?
I think it's probably all of those things. I do think there are a lot of similarities, like you're saying, between HIV and COVID, and frankly, many of the advances that came from HIV have been used towards COVID as well. Researchers who've been working on HIV for many years, as part of the AIDS Clinical Trials Group that Tony Fauci actually spearheaded, pivoted toward COVID
Whom
research.
you worked with, we should say,
yes,
closely with.
Have pivoted toward COVID research as well. Clearly, we need, ongoing education. We need outreach to those communities. Rush and the Core Center have partnered for many years trying to serve the West Side community, and I think that's a really important partnership.
Doctor, do you think we are going to see a cure in our lifetime? We've been noting a couple of instances where patients have actually been cured on their own.
Yeah, so there are a few reports. We do know of 2 patients that the medical community feels has truly been cured of HIV, but these were very specialized circumstances. People with HIV and cancer who needed a bone marrow transplant, and then they were able to receive a transplant from a donor who lacked a critical receptor the HIV virus needs to enter an immune cell, and thus once they received the bone marrow transplant and no longer had that receptor, they no longer needed to take medication for their HIV. More recently, there's been one report from researchers at Harvard where they reported about an interesting case of a woman who has been known to have HIV for 8 years and has really been not on treatment, and they looked at over 1 billion of her cells, and they do not find any replication-competent virus. So they've labeled her a sterilizing cure. Now, we know that this is an unusual circumstance. There may be rare other patients like her, but we may learn something from these patients that may help us get to a cure.
How has the pandemic, the COVID pandemic, impacted your research for AIDS, the treatment of patients, and new cases?
So certainly there was, early in the pandemic, limited ability to see our patients with HIV, and I think, there are reports that the number of people on HIV prevention medicines did decline over the pandemic. People weren't coming in for their routine care, so that's made things more difficult. We do know that new cases of HIV are continuing to occur. And in part that may be because of people not getting in for routine preventive care as well.
And what do you say to folks out there, right now watching? get out there. It's okay to come in and get your routine care, right?
Absolutely, absolutely. I think nowadays, people need to get in for their routine care and take their health care seriously.
Dr. Beverly Shaw, thank you so much for coming in.
Thank you.
Appreciate it. Be
Take
safe,
care.
be well.
Okay.